Hey guys, this is Dr. Mobeen. We are covering, as you know, the immunology questions from the topics which have already been covered. So now is the question number 8. This question is somewhat related to the question number 7 as well. So I left some of the material from the question number 7 back here on the board, and I'm just going to narrate the question number 8 here, and we'll do the similar thing, and we'll reuse the same material from there. If you have not watched the question number 7, I would encourage you to watch the question number 7 first before this one. But anyways, the question number 8 is this. You receive a 2 years old, 1 year old, 3 years old. You receive a young baby who comes to you with recurrent infections, recurrent skin infections, pyogenic infections, and pneumonias. And when that patient has come to you, you already are aware that he has CGD. So this is different from question number 7. There you were not aware that this is CGD. Here you are aware that this is CGD. You know that you have done the nitro-blue tetrazolium test with the patient. The neutrophils fail to turn the nitro-blue tetrazolium blue. So there is a problem with the neutrophil functions or immune function done by the neutrophil. The question in this particular case is that you see on the patient's skin or in the lesions, you see numerous infective lesions, and the lesions have gotten some bacteria, fungi, and other pathogens. The question are, what are these pathogens producing? What kind of pathogens are these? What kind of substance are these producing? Why are they there? So we have turned the question a little bit, the same question. First we said what was wrong with the patient. Now we are saying what is going on with these pathogens which are really taking opportunity and infecting the patient. So let's see what are our options. So the question is, what substance is being produced by the pathogens which are isolated from this patient's lesions? The choices are, so let's say the pathogen is producing coagulase, or it is producing lecithinase, or it is producing catalase, and so on. So there can be more, but let's say we take these coagulase, lecithinase, and catalase. What do you think, which substance produced by these pathogens is causing them to create the infections in the presence of a disease of CGD? So now what you have to understand is CGD should tell you that there is a problem with the myeloperoxidase. There is a problem with the NADPH oxidase, because nitro-blue tetrazolium test came negative as well. So knowing that, or the test came positive, the patient is suffering, and the NADPH oxidase is not working correctly. Again, it's an X-linked disease. It's a genetic disease. So knowing all that, now you're focusing on the pathogen, and the question is, what is this pathogen doing? Why is it surviving so easily? What's happening in these reactions? So this is what's happening. So let's say, what is coagulase? Coagulase is produced by the pathogens, for example, Staphylococcus aureus, and what that does is it works on the prothrombin, causes fibrinogen to become fibrin. So here, from prothrombin, causing fibrinogen to become fibrin, and that fibrin would cause coagulation of so the fibrin would start coating on the bacterial coat. So they will be on the capsule. So what would happen is this bacteria would be difficult to phagocytose and kill. Of course, there will be antibodies which would come and stick to this bacteria, and then it would become opsonized, it would become easy to be eaten, and then phagocytosis would occur. So in this particular case, CGD has gotten nothing to do with the coagulase. It is not that there is some problem with opsonizing the bacteria. It is not that there is some problem with the phagocytosing of the bacteria. So it doesn't look like a valid choice for us. Then lecithinase. So Clostridium perfringens, or the gas gangrene, or the myelonecrosis disease, flesh-eating disease. So in this particular disease, what happens is that Clostridium perfringens releases lecithinase and that in turn causes, the erythrocytes, the platelet, and the endothelial cells. So the cellular damage, it causes extensive cellular damage, and as a result produces that flesh-eating disease or myelonecrosis. So again, here with the CGD, this patient has not come to you with the gangrenes of the tissues. The patient is coming to you with the pyogenic infections. So this does not seem to be the answer. So by way of elimination, catalase seems to be the last answer, so that should be the correct one. But let's try to explain as well that why catalase is the answer. So let's see. Here, this is one portion, H2A2 hydrogen peroxide. So we were looking at the actions which happen in the neutrophil. So phagolysosome is formed. That phagolysosome has some chemical substances, chemical reactions occurring. One of the reaction is NADPH oxidase, which is working on the oxygen to create the dioxygen radical or superoxide. This superoxide, very, very strong antibacterial or anti-pathogenic substance. Then is the superoxide dismutase, which works with the oxygen superoxide plus hydrogen to produce hydrogen peroxide. This hydrogen peroxide is also very strongly antibacterial. It is very, very strong antibacterial. So remember, macrophages go up to this level and they are able to kill the pathogens. Neutrophils also have myeloperoxidase, which would create bleach. So here the problem is, so the first point to note, all living organisms, all oxygen consuming organisms produce hydrogen peroxide. That is just normal. We all do it. Our cells do it, fungus does it, bacteria does it. So living organisms produce hydrogen peroxide. So let's say we are talking about the patient with the CGD. This patient is having this first step. This step is defective because the NADPH oxidase enzyme is not working. So this step is not happening. When this step is not happening, patient doesn't have the substrate to offer to the superoxide dismutase to produce H2O2. So patient doesn't have free radicals themselves to kill the pathogen, and the patient does not have H2O2 to kill the pathogen, neither does he have the HOCl. But here is what is very interesting. Those organisms which are in the phagolysosome, they themselves, when they are living, when they are breathing, when they are metabolizing, these are producing H2O2. So a neutrophil can become, a little clever, a macrophage can become clever and pick up that H2O2 which is produced by the pathogen and turn it against it, create bleach and pour it onto the pathogen and kill it. But some of the pathogens are very, very smart. They know we will pick up the H2O2 produced by them. It's like we take a knife from the bacteria and then stab the bacteria. So bacteria is saying, hey, you know what, I got my own knife. So cool, that bacteria has gotten its own knife, and that knife is what? That is H2O2. We say, hey bacteria, can you give me your knife? And he gives us a knife and we slash the bacteria from that. So that is the H2O2's role. So some bacteria are sharp, they're clever, they've seen this happening to their brethren. So what do? They say, no, I'm not going to give you the knife. I would hand you the knife, but I'll hand you catalase as well, which will break the knife. So the function of catalase, so if I add one more reaction here, the function of catalase is to pick up two H2O2s. So this is happening with the catalase, and it converts them to water and oxygen. So it decomposes them. And that water and oxygen, these are harmless substances, and so all of a sudden a very harmful substance has been converted to a couple of harmless substances. That is how even we will neutralize the H2O2 if need be. Now some bacteria, for example Staphylococcus, has gotten catalase. These are catalase positive bacteria. So when they come in, they are sharp, they have the knife, they do produce H2O2, but they also produce catalase. So they'll hand you the knife and then they'll break it as well. And so now you've gotten a broken knife, you're not going to be able to do anything with that. So that is what is happening with the catalase. So here we are saying this is a patient of the CGD chronic granulomatous disease, and that patient is having a problem at this stage. So if that patient is having a problem there, if somehow we can produce H2O2, then the patient can make the remaining parts of the reaction and kill the pathogen. But some pathogen will come with the catalase. They will produce H2O2, but they would waste it very quickly as well, and the patient's neutrophil will not have a chance to use that and turn it around against that particular pathogen. So that is what's happening. So in this particular case, question number 8, which the pathogens present on the CGD patients, numerous pathogens, what are they producing? Coagulase or lecithinase or catalase? And so the most commonly surviving and opportunistic pathogens in this particular patient with the CGD would be the catalase producing pathogens. So thank you very much. We'll continue.